Wonderful, everyone. Um, Good morning. My name is Ray Santos, and I'm the Chief Development and Community Relations Officer for Ethos. And I want to welcome you to the next in our series of conversation on aging events. Um, Today, we're going to be talking about social isolation, the difference between lonely and being alone. And we have a great presentation and panel discussion available for us today. Just a few short housekeeping notes. We ask that if you have questions, you can use the Q&A function within Zoom. You'll see that at the bottom of your screen. And also, we will be conducting a brief poll in about 15 minutes. So do take the time to complete your answers as one quick question, and it should only take you about 1 minute to complete. With that, let's get into our presentation. Just a few comments. Social isolation is one of the biggest challenges for older adults. It's one that we deal with every single day at Ethos. Even before the COVID-19 pandemic hit, according to a nationwide study, an estimated 25% of adults over 65 were socially isolated. So loneliness and isolation, leads to serious health challenges, including increased rates of anxiety, suicide, and depression, a 50% increase in dementia, 29% increase in heart disease, 32% increase in stroke, and 4 times the risk of premature death, according to research from the Centers for Disease Control. So obviously, this is a topic that's very heavily on our mind, and we have an incredible a set of panelists today. We have Kathleen Mckinnis Dietrich, and I'll be introducing, telling you a little bit more about her today. She's a professor, former professor of social work at BC, and one of our active volunteers at Ethos. We have Sue Tina, who's our director of home care, who's been with Ethos since 2003, and she's has a wealth of experience working with older adults. And we have Ann Glora, who's our healthy aging program manager, who helps oversee all of our community-based health and wellness programs. And we also have Patrice Gattozzi, who's part of our community relations team as our nutrition activities coordinator, and she's going to be helping me with managing the chat and polls and answering questions along the way. So with that, I'd like to turn this over to Kathleen Mckinnis Dietrich. Kathleen Mckinnis Dietrich has been actively involved in research and teaching about aging for over 40 years. She's written extensively about mental health concerns of older adults, caregiving and aging parents and partners, and care at the end of life. She holds a master's degree in social work from Tulane University and a PhD in social welfare from the University of Wisconsin. She recently retired as the chair of the Older Adults and Families Concentration at Boston College School of Social Work, and she's currently one of our Shine program counselors here at Ethos, and she's been just fantastic. What a great resource we have. And with that, I'll turn it over to you, Kathleen. Katie.
Okay, getting this to. Okay, we gotta go back here. Sorry, we have a little technical difficulty here. All right.
Not to worry.
Okay, are we all set? Everyone can see it? What I want to talk about today is really the important distinction between, when it's okay to be alone and when that being alone really turns into loneliness, which often is the first indication that people are socially isolated. So just in terms of when we talk about what does social isolation means, it means how much social contact do you want minus how much social contact you get. And does that equal, are you lonely or just alone? I also want to preface these remarks that oftentimes for some people, not necessarily during the pandemic, you're getting more social contact than you want, so that situation can also happen where people feel overwhelmed, but that's not what we're talking about today. We're really helping people to identify in themselves and in their loved ones as caregivers, as friends, as neighbors, as family members, whether or not someone is socially isolated. So let me first talk about the whole phenomena of being alone but not lonely. Now, for those of you who have any introvert tendencies whatsoever, there is something wonderfully precious about time by yourself, because that is what nurtures you. You get your energy from time alone, from other kinds of activities, and it can be very important for your own mental health to be alone. And it isn't necessarily mean being lonely. It's what we call functional solo time. People can entertain themselves. I think often of some of the older adults that I worked with who could spend all day in their garden, who could spend all day on crafts, or spend all day reading, and in many respects never felt a pang of loneliness. It was their choice, and it was how they were able to nurture themselves. It can be a very happy state. However, if someone is alone for too long, it can make the next step over, which is becoming socially isolated, or really lonely first and then socially isolated. So let's look at what are the signs of too much time alone. And when I was making up this list, I thought, this is what we're all going through right now with the pandemic. You know, we're socially isolated out of almost necessity. So I want to address that issue as we go along. For people who have been alone for too long, too much, where it has become the way their life is dictated and run, the anxiety of being with others is paralyzing. Now, that's different than being scared to death to go to the grocery store because of what's going on right now with the virus. It's just active effort after active effort to avoid any contact with other people, because it's easier to be by yourself. You know, those people have been, and that's beyond extreme introvertism. It is people are so anxious about being with other people, then perhaps you spent too much time alone. It's sort of, you know, the opposite of what you think. If you have arthritis, you know very well that arthritis does better if you exercise the joint. Even though it hurts, when you exercise, it's better. It's the same thing if you're too much alone, then being with other people can be helpful for that. There can be an aggressive avoidance of people. And this is interesting in the phenomena now of people who don't answer their phone. Now, I understand people don't answer their phone oftentimes because they're afraid of market, or they don't want to deal with marketers or nuisance calls or other kinds of things. But if you actively avoid answering the telephone when it's somebody that you know, because it's easier not to have a contact with people, that is a very bad sign. That's a sign of too much time alone, that you may be socially self-isolating under those points. But it's a very aggressive avoidance of people. Or if you have a neighbor that you see and it's not because the interaction is negative, you just are not in the mood and aggressively avoid contact with other people, that's a sign that you have spent too much time alone. This one actually makes me laugh a little bit about personal hygiene. They would say people stop getting dressed every day or stop taking care of their, you know, personal hygiene. We've lots of jokes about what people have done during the pandemic in terms of only getting, you know, acceptably dressed from the waist up and wearing pajama bottoms all day. You know, this is that's pandemic related. But for people who stop brushing their teeth, stop getting dressed, stop doing basic kinds of self-care, that's a bad sign that they may have been alone too long. Hypersensitivity is another sign where people can become annoyed and aggressive with almost no slight. There's been a fair amount in actually pop literature about what are the straws that have broken people's backs during the social isolation, like the mom who's doing fine, you know, working with her kids at home until someone can't find a shoe, something very small. That happens for people who have spent too much time alone too. Everything is an irritant. You get angry with the television, you get angry with your neighbors, you're hypersensitive to every sound, you're hypersensitive to people walking in front of your house. It's just an extreme reaction to what is a normal event. Also, if people have chronically poor self-esteem, that is oftentimes a sign that they have spent too much time alone, that they simply are not getting enough social input, which is something that we need to grow, but also just to survive as a human being. And people who don't get enough will oftentimes have poor self-esteem. So let's talk, that's alone. And those are some of the dangers of having too much alone time. Let's look at what we mean by loneliness. Loneliness is predominantly a feeling state. It's the feeling of being abandoned or forgotten, a pain, a depression, a need, an absence. There is an emptiness that is there, and something is missing. And that is different than just being alone. It is a gnawing, agonizing sense that you're missing something. It could be someone, but there's simply not enough social interaction to give you a healthy psychological state. It's an empty pit. I have heard older adults that I've worked with describe it as describe depression as a black cloud. They describe loneliness as a black hole. There's something inside of them and that there's something missing and they're just incredibly lonely. And you don't always know, and maybe you know when you're feeling that, some people don't know. So the other thing that I'm just going to throw in here too is there's also another possibility, and that's people are bored, and boredom is not actually a pathological state by a long shot. It's a sense of feeling weary because you're unoccupied. And if you've ever raised kids, there are times when they say, I'm bored, find me something to do. And it's for lack of enough things to do. And if you are watching this webinar online, you have access to a million things to do, Being bored is the easiest problem to solve if you want to solve it. So, and we'll be talking about the activities that will be discussed later in this webinar. Really pay attention to what other kinds of things that you can do that will bring you into contact with other people, that will also solve that issue of being bored. Okay, and why does it matter? Some of this Ray talked about in the beginning. Why does it matter that we pay attention to social isolation? Social isolation is as dangerous to your health as smoking 15 cigarettes a day. And I know from former smokers that I've talked to, and they said it's nowhere near as enjoyable, for people who once smoked and quit. But that's 15 cigarettes. That's 3/4 of a pack of cigarettes. I mean, that's how dangerous it is to your health in terms of what it does to your veins, what it does to your blood pressure. People who are socially isolated have higher blood pressure, which can lead to heart attacks and strokes. So there's a real physical manifestation of what that's like. There's also rapid cognitive decline. People who are cognitively stimulated by other people do much better in terms of later onset of any dementia, if it's developed at all, that it just helps them to keep their mind working, a conversation. And certainly anybody who works in a congregate setting with older adults knows that you need to stimulate people's minds, keep them constantly stimulated to some degree, or we start to lose people. It's you don't use the brain cells, you're going to lose them at that point, and that can be incredibly dangerous. It damages the heart in terms of causing internal damage to your veins. Also, we find people die earlier. There's a shorter lifespan for people who are socially isolated. And some of that is because people who are isolated tend not to have as good nutrition, that they tend to not take as good care of their health as other people who may be in a setting where a spouse or partner will say to them, you haven't been to the doctor, and I noticed this cough, or I noticed this issue, and being in that kind of supportive environment. So social isolation isn't just a short-term thing. It's very serious in terms of what happens to people and what happens to their body after time. Okay, now I would like everybody who's listening to really begin to think about what are the kinds of things that contribute to social isolation and how at risk are you? And I think sometimes people don't recognize exactly how high risk they are. Have people had recent losses? And this isn't just the death of a significant person. There are all kinds of losses. It's loss of a job if you just retired, it's loss of financial well-being, it can be loss of social contact, it can be loss of a pet. That's a serious one. That's as serious as losing a family member. What kinds of losses have people had? And certainly when we look at older adults, the kinds of losses they face on a regular basis, they have lost oftentimes, what their life work was, connection to partners or spouses or friends. They lose their hearing. You can lose your eyesight. All kinds of things can happen. All of those are considered recent losses and put you at higher risk for social isolation. Are you being a caregiver? Caregivers are incredibly socially isolated if they never have that opportunity to get to talk to other people, or when you're taking care of someone who has dementia or some other cognitive decline, then it can be like you're all by yourself. You're really by yourself if you're taking care of someone who can't communicate and can't hold the other side of the relationship. And that caregiver can be a spouse, it can be a family member, but it can put you in the position of being isolated. And that that has to do as much with people who are caring for someone who is old, as well as someone who is older. Is there a lack of family nearby? And family is broadly defined here. And I mean, family can be individuals who you are biologically related to. It can be a family of choice. It can be, especially for populations who may be alienated from their families, as is true for LGBTQ sometimes, their family is their family of choice. They have designed their own family that may replace, or they just may not have contact with them. And so it's important, if there's not a family member close by, people can become very isolated. The other thing is you can have all kinds of family close by and not be in contact with them too. So, I mean, that's also a possibility. No transportation. And how common is that? We were just having this discussion with some friends about, will we ever get on the subway again? Will we ever get on the T? When will it be safe? And that's a great way to get downtown, but do we feel safe doing that? And for people who don't drive, don't have access to public transportation, can't afford some of the other options, they become incredibly isolated. Do you tend to be an introvert? Are you the type of person that tends to shy away from contact with other people anyway? It's more likely you could end up being socially isolated because of that. And I think here we need to cut a wide swath for people who are introverted, because it's and it's hard if you're an extrovert and aren't getting attention. It's hard if you are an introvert and you don't want the attention and you can't get it anyway. Lower income. People with lower incomes tend to be more socially isolated. Although there's a whole nother school of thought about people with lower incomes are better at developing some social relationships and social networks, but that's another thing. And are there health issues that keep you at home, that you can't get out, that it's hard? And winter in New England is vicious. It's very difficult. We've been spared a lot of it. And it's worse in other parts of the country, but it doesn't matter if this is where you live. And when it's cold and when it's difficult, people can feel incredibly isolated. So we're concerned about social isolation primarily because what it does is it can really contribute to depression. And once people are depressed, a whole range of other kinds of things can happen. People can become physically ill, but I think if they can become physically ill, it's a very serious sort of never-ending cycle. You don't feel like being around people, so you're not around people, and you get more depressed. And the more depressed you get, the more sort of inner focused you get. And it's really tough. If you're alone a lot, your perception of what is accurately going on is shot. It's not good. You don't have a good perception of what's going on. I used to talk to my students about if they isolated for a long time and working on a paper, and how they were sort of coming out of came out of a fog after they were writing this paper. It took a little while to get used to talking to people again, and developing those kinds of social skills. Depression is not a normal part of aging. It's a loss of interest in the things that once gave you joy. And the problem is that the feeling, I think, that's so powerful is that feeling of, is that all there is? Is this it? Is this as good as anything's going to be? And it really gets to zaps your energy. That's one of the issues. People who are getting sometimes too much or too little sleep. I think it's easy to sleep much of this pandemic away. People go to bed a little earlier, they sleep in a little later. But most of all, depression is a deep, deep sadness. And in psychological literature, they really talk about depression as being anger turned inward. You are angry with self, and angry with self is an incredible zapper of any kind of physical energy. So it's dangerous, so that you can see this, you're alone a lot. That leads to a kind of loneliness. Loneliness leads to depression. Depression leads to sort of a poor psychological response. And I think the most dangerous thing about depression is it's thinking maybe the world wouldn't miss you if you weren't there. And that is for anybody who works with high-risk populations, high risk for suicide. When people say, if I wasn't here, I bet nobody would even miss you, it is a horrible, horrible thing. And it's a horrible state for people to be in, of just not caring anymore. And we know that older adults are seriously overlooked in terms of suicide, high rates of suicide, especially among men over the age of 75 who are living alone, who have some dependency on alcoholism and have a physical disability, have the highest suicide rates of any age population. That's higher than adolescents. And we don't give much attention to that, saying, well, they've had a long life. No, that's not true. All lives are worth something, and we can't let it get to that point. So now what? Now what happens? And I think this is the segue to talking about the rest of the webinar is if you see in yourself, or if you see in other people that you live with, work with, socialize with, and are aware of, what do you do about it? It's one thing to say, I'm lonely, I'm isolated, I spend too much time alone, all of those things, but none of that becomes very productive if you don't do something about it. So I think this is a segue into, we got some ideas. There's programs, there's ideas, there's resources for this. And that's an important part. And that's sort of where we go from an awareness step to an action step, which is the other people on the panel will be talking about. Thank you.
That's great, Katie. This is such great information. Before we move on to our next panelist, I want to just take a quick moment and let's have a little experiment here. I think all of us at one point or another have experienced some sort of loneliness. And I think certainly during this pandemic, those feelings have been, sort of suddenly intensified. Let's take a look. Well, let's do a little poll. This should show up on everyone's screen. Now, just take a quick moment to answer the following question. On a scale of 1 to 10, with 1 being not lonely at all and 10 being extremely lonely, please rate the loneliness that you have felt over the past 12 months. And now this is anonymous. We won't, just a quick little experiment. Let's take a few moments to answer that question. Okay, we're about 45% in. Let's give it just a few more moments here. So with about 86%, one more moment. Let's see. Almost 90% of you have completed it. And what we're seeing so far is really good, actually. The vast majority of folks who have responded, have experienced, no or little loneliness over the past 12 months. And I think, let's talk a little bit about that later on in our discussion. I think that's a really interesting finding. With that, I want to turn it over. Let's shift gears a little bit, and let's talk about what resources are available for older adults. Sue Tina is our director of home care. She's a licensed social worker whose practice area has focused on the older adult population. She's been with Ethos since 2003 and holding various roles within the home care program before becoming the director in 2018. She has an MSW from Salem State University, and she's just an incredible resource for us here at Ethos and for the community. And with that, I'm going to turn it over to Sue.
Thank you, Ray. Good morning, everyone. As Ray said, my name is Sue. I'm the Director of Home Care at Ethos. I'm really happy to be here and talk about my program. I could talk about it all day, but I won't. I wish I could see all of your lovely faces. It's a little weird being on this webinar format, but I feel less lonely knowing that you're out there. I see more than 100 of you on this webinar, so that's really exciting. So thank you for tuning in. So I'm going to talk a little bit about home care and how my program can be helpful in combating social isolation. So Ethos is an ASAP, an aging service access point. And that means that we're part of a statewide network of agencies that contract with the state to provide subsidized home care services for older adults. We're overseen by the Executive Office of Elder Affairs. So they tell us what we need to do, and they make sure that we're doing a good job. So that's how we fit into the social service system. Our goal in home care is really to help older adults stay safe at home, living independently in their community, in their home, with a sense of well-being. And we would like them to be able to do that as long as possible. And that's the goal of our services. So if you've never heard of home care before, hopefully this will give you a little taste of it. We'll have some contact information in case you have further questions. You can get in touch with us after the webinar. But basically, when we think about who comes to home care for services, it's really a wide range. We serve people ages 60 and up, sometimes younger if there is, unfortunately, a diagnosis of early onset Alzheimer's or dementia. But most of our consumers are age 60 and up, and we have some up over 100 years of age. So it's quite a span in the adult age group. So over 40-year span. And there's no limit on how long older adults can receive services from us. We can be in very long term, and we've had some consumers on caseload with us for more than 20 years. So it can be a very long-term relationship, and we know that relationships are good for combating isolation. So our consumers come to us because they need help with multiple daily activities, and some of them just need a little bit of help while others need more support from us. So I'm going to talk about what that looks like a little bit. And just so you know, we serve the neighborhoods of Southwest Boston, but these types of services are available statewide anywhere in the Commonwealth. So as I said, we serve a wide range of consumers. Many of them are active, very active still in their communities and social circles. And it's not uncommon that they might just need a little bit of help to continue to do what they do. So I'm going to give you an example of what a basic care plan might look like. So for example, a person might come to us and they might decide to get a Lifeline, Meals on Wheels 5 days a week, and 2 or 3 hours of homemaking per week. So what that might look like. So imagine a 75-year-old woman who lives alone in her own home in Roslindale, and maybe she has diabetes. So because of that, she has some neuropathy in her feet. So she has some numbness maybe on the bottom of her feet, some lack of sensation, and it makes her nervous that she might fall. And her kids worry about her too. So she comes to home care and she decides to get a Lifeline for peace of mind. So a Lifeline is a button that you wear around your neck, like a necklace, or on your wrist, like a wristwatch. And if you have an emergency and cannot reach the phone, you can press the Lifeline, and the Lifeline company will respond through an operator and through a speaker, and will ask if you need assistance. That if it's not an extreme emergency and you just want them to contact your emergency contacts, they would do that. So they might call your son or daughter or neighbor or friend. But if it's a true emergency, they would call 911 for you. So that really gives a lot of peace of mind for some of the folks who come to us. And actually, most of our consumers do have the Lifeline service. So this also puts her kids' minds at ease. They know that she'll be able to get help if there is an emergency. Now, because of her diabetes, and maybe also she has arthritis in her hands or something like that, it has become difficult to prepare nutritious meals. She can do it and she loves to cook, but it takes a long time, it's painful, and it really tires her out. So it's hard to stay motivated to do it. She finds herself eating poorly and sometimes skipping meals. That wreaks havoc on her blood sugar, and so it leaves her feeling poorly. Her son brings her some home cooked meals when he can, but he has his own kids and it's hard. So she signs up for the Meals on Wheels. She gets a diabetic meal plan, and that way she can ensure that she has a healthy lunch every day. As for cleaning her home, her arthritis and her fear of falling make it difficult for her to push the vacuum. It's tough changing the bed linens. She can do her laundry. She can put it in the washer. But once the clothes are wet, they're heavy, right? And it's much harder to lift them up out of the washing machine and put them into the dryer. So that's really tough for her. She signs up for homemaking 3 hours a week, and the homemaker comes to her home, does the cleaning and laundry, and also goes to the corner store to pick up groceries. And this means that she doesn't have to call her son every time she runs out of something. So this basic care plan is the Lifeline, 5 meals a week, and homemaking 3 hours a week. And what does this do for her? With her mind at ease, her lunchtime meals all set, her laundry is done, her house is clean, her home is picked up, she has food in her fridge, her sense of well-being is improved. So with a better sense of well-being, she feels comfortable having visitors, of course, right now, socially distanced with masks, of course. But she feels better having visitors in her home. She has the time and energy to go out to church and see her friends, socially distanced and with a mask. And so this is how the services support her independence by giving her just that little bit of help. She can do the rest of it herself, and she can continue to interact with her family and her community in meaningful ways. So that's just one example. A lot of consumers may need more help than that, significantly more help than that, and we can support them too. So some of our consumers need services every day, multiple hours a day, and they may get more help, hands-on assistance with things like bathing, dressing, toileting, or other personal care needs, even eating. They may be bedbound. They may need an aid to reposition them every 2 hours. And so that type of situation is something that we can help with also. So the amount of services that our consumers receive is really a range, and it's based on the assessment of their needs and also their financial eligibility. I do want to stop and say something about financial eligibility because that can sound a little scary for some people. There is a sliding scale for co-payments for our services, but the co-payment can be as little as 0. And although we ask about income, we never turn anyone away because their income is too high. So we will never turn someone away because of high income. And also, if the copay assigned is not affordable, we work with people on that. We're a nonprofit, so we want to make sure that the copay is never a barrier to services. So kind of to summarize, the services that we provide help consumers meet their basic needs, and that promotes well-being that enables them to continue to interact with their communities, their friends, and their family. And it also really benefits the caregivers because their caregivers can take a break when we're taking care of some of the basic needs. And that means that when they visit and interact with their loved ones, they're not spending that whole time attending to their direct care needs, and they can spend that time having more sort of meaningful interactions and conversations and things like that. So the services that we provide, they help combat social isolation both directly and indirectly. So the services, basically, I've mentioned many of them already. So we have home delivered meals, we have homemaking for cleaning, laundry, and shopping. We also have a laundry pickup and delivery service. Some of our consumers don't have a working washer and dryer, so we do have a pickup and delivery service. We have a grocery delivery service, personal care, home health aid, the Lifeline, adult day health programs. We provide medical equipment, medication delivery, companion services. So there's a lot of different services on the menu that our consumers may be able to get through us. When we provide services in the home, when we send an aide to the home, that is a chance for social interaction, and that is a chance to have a relationship. It's a caring relationship. It's based on providing service, but a lot of our consumers have had the same aide for a very long time, and some of them come to see them as family members. And so that is really important. We also, let's see, we also think that this is really important, especially now during the pandemic, because a lot of the other social visiting is on hold, right? A lot of people are not having visits from friends and family, but when our aides go into the home to provide service, they're doing so with full precautions. They're using protective equipment, they're maintaining distance as appropriate and things like that. So this is really an opportunity, maybe now more than ever, to have that connection. Some of our services really directly target social isolation and enhance connectedness. And so one of those is the companion service. So this is a worker who comes to the home. They're not there to do cleaning, laundry, shopping, bathing, dressing, anything like that. They are there specifically for socialization, to visit with the person, maybe to do some activities together. Some of our older adults like to watch the mass together with someone or play games. I've had people that wanted to work on a hobby together. do some cooking or things like that together. So that's an opportunity. We also have a telephonic version of that companion service right now because of the pandemic. A lot of folks are nervous to have someone come to the house. So we have a telephonic version where this companion will just call and visit by phone. And that's more comfortable for a lot of folks right now. We also have adult day health programs. That's where you would go to a day center and they have structured activities throughout the day. The nice thing about that too is they have a social worker and a nurse on site. So there's that extra support that way as well. But they also have a lot of just activities and things. It's a chance to socialize with peers. And then we have a couple of new services, which are kind of exciting that came along during the pandemic. One of them is called assistive technology. We're actually able to provide Chromebooks to our older adult consumers. And so they're kind of like in between a tablet and a basic laptop. But this helps our consumers to be able to connect with others. So it gives them a chance to do telehealth with their medical providers, but also to connect with family and friends. And we've had some really nice outcomes with that. One of our consumers told us she was able to join a book group online through her Chromebook. And another consumer told us that she was able to return to church services that way. She had not been able to attend church. So both of those were really heartwarming situations, and we're continuing to look at which of our consumers might be interested and able to use this technology. And then hot off the press, we have a brand new service that is just being implemented right now, which is called Electronic Comfort Pets. And this is really for our folks who have dementia or other sort of cognitive challenges, who also are feeling isolated. They may not understand as much why they're feeling isolated, but they're feeling it too. And so we have these sort of robotic cats and dogs now that are very lifelike, and you pet them and they respond and they purr and they roll over and they interact with the person. And so we're excited to roll that out and really see how helpful that can be to folks. And then lastly, I would say that a big way that we sort of fight isolation is the case management itself. Every consumer has a case manager assigned to them, and that is your dedicated person that you can call at Ethos when you have a question about your services or you need something or you just want to talk to somebody. That is your person that you can call. The case managers, before the pandemic, they did a lot of in-home visits. Now some of the visits are by phone or by Zoom, and some of them are still in person with all the precautions taken. And so that is another way that we can foster connectedness, that our consumers know that if they call Ethos, they will get to talk to someone. And even if their consumer is not working, or if their case manager is not working that day, they're on vacation, let's say, there's always someone who's on coverage covering for them. So there begins to be this feeling of like, okay, I have Ethos. Ethos is mine. I have Ethos. I can call. And so that's another way that I like to think that we contribute to helping people feel connected. So if you think that you have someone who would benefit from these services, either from Ethos or somewhere else in the state, these services again are available statewide, please do reach out, make a referral, and we or the relevant agency can determine if they're eligible for this kind of support. For us, you can reach out through our website, or you can call Boston Elder Info, and that information is being provided by Ray in conjunction with this webinar. I do want to mention too that if our consumers need other supports that we do not have within our agency, our case managers do refer out as well. So we connect people too with veterans benefits, SNAP benefits, fuel assistance, medication cost assistance, and also we refer them to the other programs available at Ethos. There are several other wellness programs at Ethos, and I think Anne is going to talk about those after me. So definitely if you come in through home care, you might also end up learning about the wellness programs, and vice versa. You come in for the wellness programs and you end up learning about home care. So there's a connectedness there as well. Again, my home care program covers Southwest Boston. So we cover the neighborhoods of Roslindale, Hyde Park, West Roxbury, part of Mattapan, and part of Jamaica Plain. when you make a referral, and anyone can make a referral, when you do that, we get in touch with that older adult or their family member, whoever is listed as the contact person, and we conduct an initial assessment. Right now, most of that is being done by phone. Some of it might have a Zoom component or an in-person component, but we will do initial assessment. And once that assessment is done, a case manager is assigned and the services can begin. And again, there's no limit on how long someone can receive services through my program. So that's basically home care in a nutshell and how we can help with connectedness. I do, if you don't mind, Ray, I do want to make one little special plug for our LGBT friends out there. I just want to say that we see you. You're welcome here, and please come join us. We'd be glad to have you.
That was great, Sue, and it's just and there was so much that we want to come back to, especially during the discussion, because I think there's certainly a number of different programs that are available to the older adults that sort of sit in the corners of our portfolio that we don't talk about as much, and I definitely want to get into that a little bit. Let's switch gears, and it's Sue was able to tell us a little bit about the programs and services available to older adults. And these are folks who, the majority of them may, need greater levels of support. But we also have so many community well seniors. Those are the folks who, tend to be a little bit more active in the community and may have transportation, may have friends that can take them places, or, may have a more robust circle of support for them. And they take advantage of all, a number of different activities and events, within our healthy aging program. And, Ann Glora has been our healthy aging program manager since 2012. She conducts outreach to elders throughout the entire city of Boston and is responsible for developing and implementing a number of different workshops, classes, and events and activities that all help keep older adults active, healthy, and connected to their community. And tell us a little bit about what you do and some of the different programs and services that we have to offer.
Good morning, everyone. Thank you so much for joining us. We appreciate you taking the time, and we're very happy that you're here. As Ray told you, I am Ann Glora. I'm the Healthy Aging Program Manager at Ethos. And if any of you have spent time with me or with my team, you've spent time in community settings. We teach healthy aging classes. We're served monthly luncheons, and we hosted informational forums, fundraisers, and special events. Well, all of that came to a screeching halt last March, as much of you know and remember and were affected by. Spending time with our seniors was not only our primary goal in our work, but it was the most fun. And we miss you as much as I hope you've missed us. Social engagement was our primary goal, so social distancing and quarantine was hard for us to take. But we took stock as a team. We came together, and as a work team, we kept a routine. We got together at the same time in the mornings. We shared notes over coffee, now through Zoom, not personally. And we put together an attack to help fight this pandemic. And what an attack it was. It took us a bit of time, but now all of our programming, educational, informational, and social, is now offered virtually. And you only need a computer or a smartphone to join us. So take some time this winter. It's cold. Nobody wants to go outside in the cold. We haven't had much snow, knock wood. But if it gets snowy and you're bored and you want to spend some time with new folks, or you want to learn something new, Healthy Aging has a few activities for you. We offer several educational programs designed by Stanford University to help self-manage chronic conditions like COPD, arthritis, and diabetes. Falls prevention programs from Boston University and the Oregon Research Institute. Mental health programs designed to improve your memory or to help you get back on track if you're feeling at loose ends, bored, or a bit depressed, as all of us are feeling these days. You'll also find programs on caregiving and healthy eating. Our informational forums like this one are continuing on a variety of topics. And as a result of COVID and the social isolation that it has caused, we've added physical activities programs to our arsenal, including bingo size. Yep, it combines bingo and physical activity, walking groups, and an exercise group that meets to exercise together weekly and then stays after on Zoom to chat. There are over 15 different classes and activities that are available for your participation through Ethos, and they're offered at no cost to you. To date, over 200 seniors have participated in 17 different virtual programs. And we have a very full winter schedule available that Ray will share with you at the end of this webinar. A quick story or two, and these are not the folks' names nor the neighborhoods that they live in, but just a few stories. Lucy from Roslindale has physical and mental health issues. She proudly calls herself an Ethos frequent flyer and is able to take advantage of many Ethos programs, including home care and home delivered meals. Her doctors have told her to continue to take healthy aging classes until we kick her out. So even virtual companionship has been incredibly important for our Lucy. Casey from Jamaica Plain and Maggie from Mattapan met in a bingo size class and realized they were both caregivers. They now attend the same caregiver support program and have become good friends, although they have never physically met one another. So join us, won't you? The more the merrier. And here's to a happier, healthier new year. Thanks for being here.
That's great, Anne. And now we'll go into the discussion portion of our event. And I see that some questions have come in. I think we've tried to answer a few along the way. And if you do have more questions, do send them in. We'll do our best to try to answer them. But let's stay in the same vein here with in terms of our healthy aging programs. And tell us a little bit about, folks sometimes come into these classes, they may not have a chronic condition, they might not have they may have a great diet and they don't need a healthy aging class, but oftentimes we see folks who attend some of these programs purely for the social aspects. Can you talk a little bit more about that?
Sure. We meet just as we're meeting here today, face to face. The information is great information, and who doesn't need to know about how to live a healthier life? Learn how physical activity is so important, or maybe changing your eating habits. One of the things that help us stay young is continuing to learn and continuing to try new things as we get older. And these activities are easy, they're fun. We're very social. We spend a lot of time just chatting, and take a chance. It might be worth your time and you might really enjoy it and meet some new folks from around Boston.
Let's talk a little bit about technology, because obviously the folks, today, they have access to technology. They have access to a computer or a smartphone, or are calling on over the phone. And some of these new programs that are sort of worked really hard to get out into into the community are now becoming available. And I know Sue mentioned briefly the assisted device technology program being funded by the state, and Anne, tell us a little bit more. We have a new program being funded by partly by the Tufts Health Plan Foundation through a grant to roll out some Chromebooks to the community free of charge for them to keep. And tell us a little bit about that program and how that can help folks who aren't really connected.
So it's just that simple. Tufts and some other funders have made it possible for us to give away computers and keep people connected to the outside world. Even when the pandemic is over, there's so much you can find online and so many ways to stay connected. This program includes not only a free computer, but someone to actually help you figure out how to get it connected and how to use it. And then some assistance in finding things online that interest you, that you want to participate in. And hopefully one or two of those are Ethos programs. But the world is at your fingertips when you have a computer, and we're hoping to bring as many seniors into that world as we can.
Katie, talk a little bit about the sort of the divide. I know that many older adults certainly didn't have a lot access to technology, and that's sort of a barrier for them. And talk a little bit about why that is so important, even more so today.
Well, I think because it's being connected electronically is how we connect. And I mean, nobody knows that better than we all do during this pandemic. I think the divide is not actually sometimes as decisive as people think due to age. I think it's oftentimes due to income, that people can't afford it. But I think actually for people who have retired within the last or stopped working within the last 15 years, good number of them are very proficient on computers. They don't need anyone to help. I mean, they've been using email for years and they're good, but it all depends on, can you afford the equipment, which is why Chromebooks are good because they're less expensive than a laptop. And that with programs such as the one through Tufts can make those kinds of resources available to people. But we see a really strong dividing thing, probably age 80 and above, who are oftentimes the people who need it most. That would have been people who didn't necessarily become computer proficient when they were working or school or any of those other things. We see, especially among boomers, I think that, which are now 75, between like 55 and 75, very often used computers in their jobs or school or whatever the case may be. So they're good. I mean, they can be proficient, but it's over 75 who tend to be a little bit more frightened by it. However, I guarantee you give an older adult a cell phone or a Chromebook and a little bit of training, and they're going to pick up just like that. I mean, and it's part of it is sending the message, you can learn this, that it's not, the computer can only do, or the cell phone can only do what you tell it to do. And it can be frustrating. So I think a supportive thing is really helpful to people who may have limited access to technology, but it can boil down to a cell phone being every bit as powerful as a laptop or a Chromebook for people because it is their connection to the internet. So I think in cases, and you can get a relatively inexpensive cell phone these days, even a smartphone through Track Phone and even some other services that people have. So there's no excuse why we can't help older adults to make that connection. It's really informing them and helping them to understand and then get a hold of technology to use.
Thank you. And this question's for all three of our panelists today. Do you think that we're going to need to rely more or less on technology even after the pandemic is over and after folks can get out into the community? Do you think this is something that's here to stay? Do you think that this is a sort of a temporary bubble? Tell us a little bit about that.
Well, I'll respond first. It's definitely here to stay. I mean, there's no question about it. It's a revolution. It's happened. It's the way things are going to be. I think it will permanently change the way classes are held coming out of the academic setting. Once the universities figured out that they had to go remotely, they now have developed lots and lots of programs and apps that help people to do that. I think people who have had kids who are going to school remotely have learned that this is a major change. It's going to stay that way. You know, we don't know how long the isolation from the pandemic is going to last, and hopefully within a year we'll be vaccinated and out of some of this. But I think the technology itself is here to stay. So let's work with it and help the most people we possibly can to have access to it.
Yeah, and I have to agree with Katie. Transportation is always a huge issue when we work with our seniors, from getting place to place. Weather is always a factor, rain, snow, ice. And the more folks we can connect virtually, the more they can stay connected. So I don't see us ever stopping producing our programs virtually. I see that as a continuation. And it's actually opened up things that weren't possible before. Now some of our participants are in East Boston, and they're participating with folks from Hyde Park and Jamaica Plain and Dorchester. So they're from all over the city, and they're making new connections and new friends from all over the greater Boston area. So in one aspect, it's been freeing for some folks, because they can take advantage where they couldn't before.
That's great. Sue, what do you think? You know, do you think that technology has helped folks be more or less connected to their case manager, and does it help them, you know, become more or less isolated?
Well, I definitely think it's helping them connect with their case manager, because we can then do our visits by Zoom instead of by phone. And so you get to see each other's body language, and it's just a whole different experience to actually be able to see someone. So I think that's definitely important. In terms of, after the pandemic, we're hoping that this becomes a permanent part of our offerings. It was initiated during the pandemic, and we're working on permanency. So we're hoping that this is something we'll be able to continue. That's sort of in development right now. But definitely we're seeing that it's really helping people to connect. I did want to mention, I see some questions about like low cost internet and things like that. And there is, through Comcast, sort of like a subsidized version, low cost internet for about $10 a month. And I put the link in the Q&A. And somebody else asked if you need internet for the Chromebooks. Since the goal is connecting consumers with others, the idea is that you would get internet service to go with the Chromebook, so that you could connect with telehealth or for social opportunities. So hopefully that answers that question as well.
Do you find that many folks that live in, housing developments, they might already have access to a Wi-Fi network, and it might just be the barrier is the device? Do you think that's?
Actually, I think that's true. A lot of them are not really having a barrier to access to internet. And a lot of them are relying on their younger family members to kind of orient them to using the device and helping them get up and running. So we haven't seen as many barriers to actually getting this going as we anticipated. So we're very happily surprised that the consumers, and often with the help of their informal support networks, are able to get the internet connection and get up and running with learning how to use it. But we would troubleshoot any of those issues as well if those were barriers. That's
great. That's great. One of the things that I always remember talking about is how the staff at Ethos, sort of serves as sort of a surrogate son or daughter, helping folks with a number of different issues, whether it's getting a ride to a medical appointment, or just sitting with them and talking about a book or playing a game, but also helping them through the technology. And can you just talk a little bit about how some of the different programs that we've had, even going well beyond before the pandemic, to help folks understand technology, understand getting connected to others virtually?
So before the pandemic, We had volunteers who would come into the seniors' home and actually work with them one-on-one with computers. We will get back to that a little bit as we get this new program out where we're delivering the Chromebooks to seniors. The contact will be through the telephone or the Zoom, not a person sitting next to you helping you out, but there will be that kind of one-to-one education available. We also worked, and we've missed the relationship with the Roxbury Latin School students who ran several technology tutoring classes for our seniors during the school year, where the young men would again sit with a senior one-on-one and help them work through issues with computers or tablets or smartphones, helping them to learn whatever technology they wanted to. One of our seniors had put together the story of his life. So the young men helped him actually coordinate that and put that into a video of the story of his life. So we've had great success with seniors using technology. And I agree, I'm a boomer myself, so I know that most of us are used to this technology now, and our older clients are just as excited about it and just as interested in learning how. So the more technology we can get out there, the better off we'll all be.
Now, one of our key values at Ethos is the right to self-determination. And I think you'll find this at, across the entire aging services network. And this question is for everyone, and Katie, for you in particular. But what would you say to somebody who is really struggling with being isolated and maybe having a tough time taking that first step to connect with somebody?
It's an excellent question, because I think that is indeed the challenge. One of the things we recommend in a therapeutic context is they do one thing a day to reach out. And maybe that's as simple as, if you live in a single family home and you get your mail delivered and you hear it come through the slot, wait long enough for the mail carrier to get away from open the door and say thank you, just one contact. One contact looking out example, once again, if you're in an area where someone is walking a pet, at a socially distanced thing, just say, oh, what a darling dog, and what's the dog's name? It's really practicing some of that as much as anything. But you have to force yourself sometimes to do it, and it may be even talking to a neighbor. If you live in an apartment complex and there's someone, that you have some initial, you're not a complete stranger, but trying to do something every single day, even within a tiny little context. One of the things, to get a plug in for this, for older adults, oftentimes who are isolated, television is an unbelievable lifeline. People become obsessed with the personalities that do the nightly news, because that person is coming into their home. It's an intimate family. I can't imagine the number of older adults who have a mad crush on David Muir on Channel 5. He's an interesting guy who is a local here, and then he went national. And I know older women, particularly, who just think of him very personally as their bud. And I think anything people can do to make that connection, to do something every day to reach out, but it's going to take people confronting. It's tough. It's really tough. The other thing too is there are chat lines. There are, like even calling. I know the people at 1-800-AGE-INFO are phenomenal. They have a lot of work to do, but they're very good. And you can do that from an anonymous thing and say, I think I just really need someone to talk to. A man who called Shine when I was working, and I said, I understand from your message you're interested in dental insurance. He goes, I don't care about dental insurance. I've been self-isolating for a year. I need somebody to talk to. And I said, I'm somebody. And we talked. So I think even if you call Shine, I hate to, put all of the connections on Shine, but even making a connection, a personal connection with one person can make a difference. But you have to move beyond that sort of the barrier that you're presenting.
Sue, same question, but maybe it's slightly different. But obviously, we can't force services on folks. But what would you say to somebody who maybe is just thinking about it right now, and thinking maybe I need a little bit of extra help? What would you say to them to sort of sort of propel them into taking some action?
Yeah, what I would say is that it doesn't hurt to just have the conversation. You could always make a referral. We would reach out to you for initial phone call and to see if you were ready to schedule an initial intake. And if you were not ready, that's totally fine. We don't hold that against you. It's totally fine to say, never mind, I changed my mind. But that at least would let you have that really more in-depth one-on-one conversation with us to find out more in detail what we offer, what you might be eligible for, and see if it's a fit. Even after we do the intake and we decide on a plan and you agree to services, if you decide the next day you're not comfortable, you can cancel at any time. It's not a contract, and you can always, stop the services at any point. So I'd say I would encourage you to be brave and call us and have the conversation. And then if it doesn't feel like you're ready for it, that's fine. We've also had many consumers where they re-referred several times over the years and they just were not ready each time. And then eventually they were ready. And so then they became a consumer at that point. And that's not uncommon. We don't charge for the intake. You don't have to pay for it. We're not disappointed if you don't want to do it. We don't take it personally. We're here, and we'll educate you about what we have to offer, and then it's up to you.
This question is for everybody, but I think one of the things that's amazing about the Aging Services Network and the healthcare community is that we're all working very collaboratively, right? We're sort of trained to make referrals back and forth to different organizations. Can you tell us a little bit, starting with Sue, a little bit about where we get referrals from and how we interact with folks, and and then anyone jump in about how important that is?
Sure. We get referrals from everyone. So a lot of times it's the older adult themselves. It's a friend, family member, neighbor, church member, visiting nurse, doctor's office, first responders, protective services. We work closely with them also. So we get referrals from everywhere. What was the second part of the question, Ray?
Well, just how we, sort of coordinate with them to make sure that all of the needs are being met.
Oh, right. Yeah. So we definitely do a lot of coordination. As I said earlier, we refer to our healthy aging programs. Every time we do an intake, we provide all of the information about those healthy aging programs. The Shine program at Ethos, which is serving health information needs of everyone's health insurance, counseling. We have a lot of interaction with them. The Boston Money Management program, we get referrals from them and make referrals to them. And then also just external resources. So if someone has a visiting nurse agency, we might be coordinating care with them, checking in with the nurse to see how things are going. We talk to people's doctor's offices with their permission, of course. So there's a lot of coordination that goes on.
Katie, talk a little bit about how sort of social workers are trained to sort of recognize the need to coordinate, and the sort of value in being within a part of working with an organization like Ethos, and how important that is.
Well, I think social workers are well trained in doing that. I mean, that's what we do. I mean, it's what social workers do, helping to identify what the needs are and what do people want in terms of help. I think we can't, I'm a great believer in the phrase, whose goals? If it's your goal, but it's not the goal of the older adult, you're not doing them any services. And I think we have to always respect, when we talk about self-determination, the older adult's right to say, no, I don't want the service. And that, no, you can't enter this in a relationship with me, that we as professionals don't know more than our clients. We may know a lot more about services. But I think the way that social workers are trained, especially those working with older adults, is that our worth as a professional is only as good as our knowledge of the service thing. We can't provide the nutrition program. We can't provide the home health care, but we can provide the access to that. So I think that social workers are very well trained. And I mean, and when you think of the program that Sue is running, that's the epitome of it, in terms of, what do you need? Here's some services we have. How can we connect people? What can be best for them? But I think it's, get ready, get set, connect is the way we try to train social workers. But I do want to put in the plug about self-determination, that what we think people need, if it's not what they think they need or are willing to work on, that we need to respect those boundaries as well. And that's very hard when you're trained as a professional helper.
Yeah. And tell us, what are your thoughts on that?
Our referrals come from all over as well, but mostly by word of mouth. Someone takes a class and calls and asks if their friend can join, or if they can reserve a table at the prom, or come to the luncheons. So our seniors tend to be, for the most part, more active. A lot of them still drive or take the ride. A lot of them are still very socially active. They come in pairs or groups of 4 or 6 and hang together. They come as family groups. We have a great group of wonderful women from Mattapian. It's a group of 5 sisters and cousins who travel in a pack, and they're loads of fun. But just to kind of go back to Sue and Kathleen, make that phone call and find out what's available for you. And you may be very active right now. You may be walking every morning. You may be cooking your own meals. And tomorrow morning, you may fall leaving the house and break a hip and need the services that are available to you. So take the time now while we're stuck inside and we have a little less to do, to find out what those resources are. Boston is a fabulous place to grow old. There are so many different services and activities that are available for an older adult. Take the time to learn about those, learn what's available for you, make an initial contact with Ethos or one of our sister agencies in the city of Boston, and find out what's available, because you never know when you might need just a little bit more assistance.
And so just a couple of quick notes. Sue mentioned that for our home care program, we serve the 5 neighborhoods of Southwest Boston, and we and some it's sort of a dual responsibility with another agency. We work very collaboratively with our other sister agencies, Boston Senior Home Care and Central Boston Elder Services, who are great partners in the work that we do. Our nutrition program is citywide, and so that a meal and a safety check and a friendly smile from a driver, sometimes it might be all someone needs, and certainly reach out and learn a little bit more about that program. And then obviously our technology training program. I encourage anyone who's interested within Southwest Boston to visit our website, www.ethocare.org. The link is in the chat, and we'll certainly send an email with some more information. Any parting words about, if you had one thing to say to folks who are either helping somebody who is socially isolated and struggling, or struggling themselves, let's go around the room here and the virtual room here, and what one thing would you say to them, after today's presentation?
Give us a call. Give us a call. We're just a phone call away. We'll call, we'll chat, we'll keep you company for a while, but take the first step. Give us a call.
Katie, what would you say?
I would say send a message, somebody does care about you. I mean, we do care about what's happening, and we do care about, the fact that for people who are needing something, that there are lots of services and lots of very concerned people who are standing there ready to be helpful. But the older adult may have to take the first step themselves. And that is sometimes the hardest step of all. I mean, it's hard to be that brave when you're in pain, but people do care. And all you need to do is make a connection, as Ann said, give them a call.
Sue, what do you think? Somebody's struggling themselves or knows somebody who's struggling, what would you say?
I would say that definitely we're here. We're here for you. I would encourage you to call and at least have the conversation. See if we're a fit for you. If not, that's totally fine. I do want to actually take a second to mention, because I see I'm trying to keep up with the Q&A and the chat at the same time, and I noticed a couple of questions about you know, services for folks from the BIPOC community, language, things like that. And I do want to mention, you're all welcome. We want you here. We do have case managers who provide services in other languages. We have a lot of bilingual, bicultural, multicultural staff. We definitely provide services in Spanish, Haitian Creole, Russian. So there's a mix. So please do come to us. We do want to work with you, and we do have experience working with these folks.
That's great. And so I'll share my screen for one last moment, give everybody some contacts. Let's see if that works. Obviously, if you want more information, you can visit our website at www.ethocare.org. Our telephone number is 617-522-6700. You can also call our citywide referral line, Boston Elder Info, 617-292-6211, or the state's line, 1-800-AGE-INFO. You can call that line for anywhere in the state. Big shout out to our sister agencies throughout the rest of the state who do great, incredible work as well. I want to thank my panelists for an incredible presentation. Thank you so much for being with us today. This has been, I think, just so important for all of us, especially since we're all home and working so hard to try to make sure that people stay healthy, safe, and connected during this pandemic. And hopefully we'll see everyone soon. And with that, we'll be concluding our presentation. Don't worry about some of the information that we shared today. We'll be sending you an email with more resources, a link to watch the presentation in case you want to go back and share it with others. And as always, if you have other questions, please reach out to us. Visit us on our website, ethocare.org. Send us a message through our contact page, and we'll do our best to get back to you and answer all of your questions. And if we can't answer your question, we'll certainly refer you to someone who can. And with that, I wish everyone a wonderful day, and thank you so much for attending.